Suspected spinal and neck injuries are serious. They can lead to paralysis if they are not managed properly. They typically occur as a result of falls from a height. They also occur during collisions, which may cause whiplash, a direct blow to the neck or spine, or a penetrating injury such as a wound from a knife, gun, or other weapon. Symptoms include pain around the injury site, numbness or tingling in the hands or feet, tenderness, and loss of power or movement. When treating neck, head, or spinal injuries, it is important not to move the casualty unless there is imminent danger. Hold the person's head and spine steady with supports. If available, apply a cervical collar or use a folded towel or newspaper instead. Call immediately for medical help. Head injuries include damage to the skull and brain. They are potentially very serious and should be managed carefully. A range of symptoms might be observed: blurred vision or slurred speech, a loss of memory, signs of confusion, headache, bleeding from the nose or ears, change in the size of one pupil, or nausea.
First aid treatment should be given following the doctor's ABCD process. The head and neck should be supported and the airways kept open. If the casualty is unconscious and no spinal injury is suspected, place the casualty in the lateral position.
If there is evidence of skull fracture, for example, discoloured eyelids or bleeding from the ears, it is critical not to apply pressure to bleeds from the head. If fluid is coming out of one ear, place a dressing over it and carefully turn the casualty's head so it drains. In all cases, seek immediate medical help. Eye damage can be caused by a range of factors, including foreign bodies, a direct force, or penetrating injury. Symptoms include watering and irritation, redness and pain, and the inability to open the injured eye.
For minor eye injuries, wash the eye with water or saline. Avoid rubbing the eye or removing any embedded objects, as this may lead to further damage or loss of vision.
Injuries to the nose typically occur through direct force or a blow, which causes bleeding and possibly a broken nose. Another source of nasal injury is the presence of foreign objects up the nose, which is not uncommon in small children. Symptoms of a nose injury include pain, deformity, nose bleeding, and bruising in the affected area.
In the event of a nosebleed, place the casualty in a sitting position with the head and shoulders leaning forwards. Advise the casualty to breathe through their mouth and apply pressure just below the cartilage for 10 minutes or until the bleeding stops.
Apply ice or a cool wet towel to the forehead or back of the neck and call for medical help.